Good day, viewers. Welcome back to DDM Health News Updates. On our program, Your Health, Your Wealth. Listen, viewers, if you have not subscribed to our YouTube channel, DDM, that is the Dashboard Digital Media, you are missing a lot. I did tell you. So don't hesitate to do so that you can get the latest info. So what do you have today? Someone donates 50 million in Taraba State. Guess who? Wife of the president, Senator Oluremi Tinubu, has called on traditional rulers across the country to actively support the federal government's Renewed Hope initiative by mobilizing their subjects to access free healthcare services, particularly in the areas of HIV and AIDS, tuberculosis, and maternal and child health. Mrs. Tinubu made the appeal on Thursday during an engagement with traditional ruler in Jalingo, that is the Taraba state capital, as part of her official visit to the Northeast. The First Lady emphasized the crucial role of grassroots mobilization in tackling health-related challenges, especially among vulnerable populations such as women and children. She valued our women well, though. We are here to encourage our frontline health workers by recognizing their efforts and providing them with incentives, she said. We believe that once our health workers are properly supported, the incidence of maternal and infant mortality will drop drastically. We are also intensifying awareness about HIV and AIDS, particularly to curb mother-to-child transmission, which remains high in some areas. Senator Tinubu noted that traditional institutions remain strategic in the implementation of health interventions, especially in rural communities where their influence is deeply rooted. On his part, the coordinating Minister of Health and Social Welfare, Professor Ali Pate, disclosed that over 8,500 frontline health workers have so far been trained in the Northeast, with 1,300 of them drawn from Taraba State alone. Professor Pate added that no fewer than 1,000 primary health care facilities in the region now benefit from quarterly disbursements under the Basic Health Care Provision Fund, with 170 of such facilities located in Taraba State. These are deliberate steps by the federal government to ensure that healthcare resources get to the grassroots where they are most needed. That was the minister noted. Also speaking at the event, Taraba State Governor Dr. Abu Kefas and his wife Ayin Kefas commended the First Lady for her visit and the ongoing support to the state under the Renewed Hope initiative. As part of her visit, Mrs. Tinubu presented 10,000 professional kits to midwives across the 6 states of the Northeast geopolitical zone. Wow! And she also handed over a 50 million naira check aimed at empowering 1,000 women in Taraba State. I tell you, say she loves our women well.
We are here to do that and also to raise the awareness for HIV AIDS and hepatitis A and also CNS, because we see that most people are not talking and unfortunately the rate of mother-to-child transmission of HIV is very high. So that's why the minister too is here, so that we can bring awareness to it and take the traditional areas, especially because we know that you are the custodian of the land, the people that they directly relate to you, how they relate you to help us maybe send the message down about this.
Up next, the federal government has issued a fresh alert revealing that no fewer than 1,249 communities across 176 local government areas in 30 states and the Federal Capital Territory, that is the FCT, are expected to experience serious flooding between April and November 2025. This warning was made public on Thursday during the launch of the 2025 Annual Flood Outlook, that is AFOM, by the Nigerian Hydrological Service Agency in Abuja, that is the NIHSA. Minister of Water Resources and Sanitation, Professor Joseph Utsev, who unveiled the report, painted a worrying picture, noting that climate change continues to intensify the frequency and impact of flooding in Nigeria. According to Utsev, the high-risk flood zones include major states such as Abia, Adamawa, Akwa Ibom, Anambra, Bauchi, Bayelsa, Ebonyi, Edo, Gombe, Imo, Jigawa, Kebbi, Kogi, Kwara, Lagos, Nasarawa, Niger, Ogun, Ondo, Osun, Oyo, Rivers, Sokoto, Taraba, Yobe, Zamfara, and the FCT. He added that coastal and riverine states like Bayelsa, Cross River, Delta, Lagos, Ogun, Rivers, and Ondo will likely face flooding from sea level rise and tidal surges affecting fishing activities, wildlife habitat, and water transportation. The 2025 AFO shows that 1,249 communities fall under high flood risk zones, while another 2,187 communities in 293 local government areas across the 36 states and the FCT are listed under moderate flood risk areas. That was what the minister said. Utsev also said or raised concerns about the increased chances of urban and flash flooding in cities, citing poor drainage systems, unmanaged waterways, and the lack of flood resilience structures as major culprits. But he maintained that unlike some natural disasters, flooding is preventable with proper planning, infrastructure, and timely community engagement. He emphasized that this year's forecast offers community-specific predictions designed to boost grassroots preparedness and response. In his remarks, the permanent secretary of the ministry, Mr. Richard Felongwa, called on stakeholders across sectors to take early warning systems seriously. This outlook is not just about data, it's about protecting lives and livelihoods, he said. Also speaking, NIHSA Director General Dr. Umar Mohammed stated that this year's forecast is more refined and data-driven, thanks to advanced technology and stronger inter-agency collaboration. Wow. He noted that the 2025 AFO is designed to go beyond the usual maps and figures. We are now focusing on the real-time impact on health, agriculture, infrastructure, and education, helping decision makers with more practical tools for disaster response, Mr. Mohammed said. The unveiling of the 2025 Annual Flood Outlook marks a new phase in Nigeria's flood management strategy, one that leans heavily on science, resilience, and community action. Up next, in a swift response to reports of flooding in parts of Lagos Island, the Lagos State government has deployed pumping machines to Aroloya Street, Ojogiwa, Binoyo, Oroyini, and surrounding areas to mitigate the impact of stormwater caused by blocked drainages. Commissioner for the Environment and Water Resources, Mr. Tankubu Wahab, made this known on Thursday through a statement posted on his official X handle. what that means. That is trader formally. Wahab noted that the intervention is aimed at revealing residents and business owners currently grappling with waterlogged streets and limited access due to ongoing construction works in the area. Following reports of the inconveniences being experienced by the residents of Aroloyo Street, Ojogiwa, Binuyo, Oroyini, and other areas in Lagos Island, the Lagos State government has set up pumping stations in the area to pump out the stormwater and relieve residents and business owners, he said. The commissioner explained that the current flooding was a temporary situation resulting from construction activities under a broader regeneration project initiated by the state government. According to him, it should be noted that the state government has approved a total regeneration of Lagos Island to include improving and expanding the drainage infrastructure, primary and secondary channels, constructing pumping stations with smart sensors of flood control, and promoting sustainable urban regeneration by reconstructing major roads within the areas of addressed tidal challenges. Contractors are presently on site. Wow, kudos to the government. He stressed that the temporary drainage blockages are part of the larger infrastructural upgrade and not permanent issues. Wahab appealed to residents for patience and cooperation as the administration works to deliver long-lasting solutions to flooding and poor drainage in the area. We plead with residents to bear with the government as the construction will be completed in a very short time. Stakeholders are expected to contribute by properly disposing of their waste in accordance with the guidelines set by flow labs and by cooperating with the contractors. While admitting that some level of disruption is unavoidable during such extensive works, he assured the public that the welfare of Lagosians remains a top priority of the Sanwo-Olu-led government. While efforts are being made to minimize inconveniences, occasional disruptions may occur, but be best assured that the welfare of Lagosians is paramount to the government, Wahab added. The Lagos Island Regeneration Project is part of the broader urban renewal agenda aimed at building a more resilient, flood-resistant, and livable megacity. Wow. Up next, the National Agency for Food and Drug Administration and Control, NAFDAC, has restated its unwavering commitment to ensuring the safety, quality, and effectiveness of generic medicines across the country. Speaking during a media parley on Thursday in Lagos, the Director General of NAFDAC, Professor Mojisola Adeyeye, disclosed that the agency is now enforcing mandatory bioequivalence studies as part of its regulatory measures to sanitize Nigeria's pharmaceutical landscape. Professor Adeyeye said the move is designed to build public confidence in generic drugs and tackle the menace of substandard and ineffective medications circulating in the country. Bioequivalence studies are not optional. They are a scientific requirement that confirms that a generic medicine is just as effective and safe as the branded original, she explained. These studies give assurance to doctors, pharmacists, and patients alike that generic deliver the same therapeutic benefits. The NAFDAC board noted that the agency has rolled out a strategic action plan to guide pharmaceutical stakeholders in complying with these requirements, including updated regulations and operational guidelines for contract research organizations, that is the CROs. She said, "We have released a comprehensive note to industry detailing expectations and requirements for CROs, and this is available on our website. It is part of our effort to promote transparency and compliance." Professor Adeyeye further revealed that the agency is investing heavily in capacity building with targeted training sections for NAFDAC staff, healthcare professionals, researchers, and industry partners. According to her, the training are essential to ensure smooth implementation and understanding of bioequivalence protocols within the health sectors. The success of this initiative depends on the collective support of all stakeholders. We call on pharmaceutical companies and healthcare providers to embrace and prioritize the use of NAFDAC approved generics that have passed through rigorous regulation processes. She maintained that the press briefing was one in a series of stakeholder engagement efforts to deepen awareness and foster collaboration in strengthening Nigeria's pharmaceutical regulatory framework. Wow, truly, the NAFDAC are really on work. They are really trying. Well, viewers, finally, the United Nations Children's Fund, popularly known as UNICEF, has raised concern over the lingering presence of the polio virus in Katsina State, describing it as a major threat to child health and development in the region. Speaking on Thursday during the official signing of the UNICEF Katsina State Multi-Year Work Plan for 2025 to 2027, held at the Government House Chamber, Kano Field Office Chief Mr. Rahama Farah called for intensified efforts to eliminate the virus. Farah, who was represented by the health manager of the UNICEF Field Office, Dr. Serike Deris, stressed that polio remains a public health concern in the state and called on all stakeholders to ramp up strategies towards its eradication by 2025. That means throughout this 2025, polio, they go come out to finish. I can't wait to hear that. As we speak, the polio virus is viral in Katsina State, but their work definitely will work towards that to eradicate everything completely. So, polio remains a significant threat to children's health in Katsina State. Eradicating it must be our top priority come 2025. Dr. Deris emphasized the need for robust community mobilization, awareness campaigns, and targeted interventions that would ensure no child is left behind in the ongoing vaccination drives. The Katsina State government must take the lead at the ward, district and local government levels to tackle vaccine hesitancy and refusal. Community leaders, religious leaders, and local government area chairpersons must be fully engaged and held accountable for ensuring that every eligible child receives the vaccines, he added. He further urged the state government to reveal its resources, exploit public-private partnerships, and strengthen community-driven health initiatives. UNICEF also appealed for increased investment in critical sectors such as health, nutrition, water, sanitation, and hygiene, child protection, and social protection to build resilient systems that are less reliant on donor funding. Responding, the governor of Katsina State, Malam Diko Umaru Rada, reaffirmed administration's commitment to working hand in hand with UNICEF to combat the virus. Wow. Rada disclosed that the state government has released 500 million naira as counterpart funding for UNICEF-related interventions last year and assured continued financial support to ensure successful implementation of the 2025 to 2027 action plan. Kudos to the government. Seriously, the governor really loved its children wholeheartedly. I can say that. We will do our best to ensure the full implementation and success of this multi-year plan. The health and well-being of our children remain a top priority, Governor rather said. You can imagine that. This will be all for now, viewers. Do ensure to click on the like button, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more latest news updates. I remain your host, Nenyer Michael Inezine. Thanks for watching. Bye for now.